This is a guide for how to use the lumenis YAG and SLT duet laser in the Olive View Eye Clinic. Here is a diagram of the laser, including all of its various adjustment knobs. First step after plugging in the laser is to turn on the laser, which is done with this key here, which is shown in its off and on positions. When you turn on the laser, the slit beam and screen should both automatically turn on. Next, you want to select the type of laser you want to perform, either a YAG or an SLT. The YAG is used for capsulotomy, peripheral iridotomy, vitreolysis, and lysis of other things in the anterior chamber, while the SLT is used for IOP reduction in patients with open-angle glaucoma. After turning on the laser, you want to position your patient, so you can adjust the table height, the chin height, and then there's also a head strap that you can use if needed, if the patient moves around a lot. It is important to make sure both the patient and the physician are in a comfortable position without hunching over or stretching out too much before beginning the laser. Next, you can adjust the laser power, which can be done directly on the screen or on the machine itself. As far as the power to use, SLT is usually done between 0.7 to 0.9 millijoules. You want to see champagne bubbles on some of your shots, but not all of them. If you're seeing champagne bubbles on every shot, then turn the power down. And if you're not seeing any bubbles, then turn the power up. For a YAG laser, if you're doing a capsulotomy, you can start around 1 millijoule and try not to go higher than about 2 millijoules. For an iridotomy, you can start around 3 millijoules and try not to go higher than 10. Generally speaking, if the patient has been pre-treated with argon, then less YAG power should be needed. For vitreolysis, you can start around 2 to 3 millijoules and again try not to go higher than 10. More information on laser settings is available on the iGuru website, which is made by Stein Residency alumni. It's important to be able to see your aiming beam, so you can adjust the intensity of this on the screen. You should be able to easily see a red dot that shows you where you're aiming. So if you can't see the dot, then adjust the beam to make it more intense. Before starting your laser, you can also make other adjustments as needed, including magnification, illumination intensity, the swivel. Sometimes if you're having a hard time focusing, just moving the swivel around will help you focus. You can put in a posterior offset if you're going to do a YAG and you're trying to avoid pitting the IOL. And then finally, there's adjustments for beam color and pattern, which we rarely use. Finally, before starting your laser, you want to take it off standby. The laser will make a test fire noise, which is harmless but can be somewhat alarming. It's okay for this test fire to occur with the patient completely in position. Next, you want to perform your laser. An SLT that's 360 degrees is about 70 to 100 shots. For repeat SLT, you can do either 180 or 360 degrees. In general, you want to try not to repeat this more than 2 to 3 times total per eye. The laser is done with a Latina lens, and you want to focus the aiming beam on the trabecular meshwork. For an LPI, this can be done in a temporal or superior location. The temporal location may have less photopsias. You want to keep shooting the laser until you see a plume of pigment coming out from where you're shooting. You can pre-treat first with argon, which may make the YAG part of the laser easier. The argon can be done anywhere between 300 to 1,000 milliwatts from 20 to 100 shots. If the patient starts to bleed during the laser, just hold pressure with the lens in place, and usually the bleeding will stop pretty quickly. And for this one, you want to use the iridotomy lens. For a YAG capsulotomy, this can be done with the Abraham lens or also without a lens. You can do this in a cruciate or a can opener pattern. The number of shots depends on how many shots you need to open the central capsule, and most importantly, you want to focus the aiming beam on the posterior capsule and to avoid the cornea and avoid the IOL, because you don't want to cause damage to the cornea or make a pit in the IOL. Finally, you want to finish up. For patients who get SLT and LPI, they should get their IOP checked about 15 to 30 minutes after the procedure before sending them home from clinic. After the SLT, patient can use ketorolac 4 times a day for 4 days, and after LPI, patient can use prednisolone 4 times a day for 7 days. In both situations, the patient should be rechecked in about 6 weeks after the laser. After a YAG, you don't